This is the first position to alleviate the symptoms of spinal stenosis. It's called the Z-lie position. So you lie down on the floor or on a mat or on the carpet, put a pillow under your head, get a chair, or this can be your couch, and you put your knees and your legs there and adjust the position until you can feel that your knees are above your abdomen level, and the small of your spine here, the lumbar spine, is relaxed. And once you find this position, you can stay here for a couple of minutes and adjust, and you can bring closer and adjust. And once you find this position, you can be here for 5 minutes, 10, even 20 or 30 minutes to alleviate the pressure and pain on your lumbar spine. You may have noticed that I showed this position, this Z-lie position, in my previous videos for disc problems, degenerative disc disease, facet joint syndrome, lumbar disc herniation, sciatica, and now for spinal stenosis. So because this is an excellent position to really relax the pressure on your lumbar spine. This is the second position to relieve the symptoms. It's called knee to chest. You're going to lie down on a mat with a pillow under your head, and then you're going to start slowing, bringing your knees towards your chest. And here you see the small of my spine, the lumbar spine is flat. And then I'm going to wrap around. You can wrap around your knees, but if you have knee pain, you may do this under your knees. It doesn't matter for the spine, but just try to avoid knee pain when you do this. So here, you're going to wrap your arms around your legs and relax. The most important thing is that you breathe, relax. So try not to do this, okay? Don't hold like this because your blood pressure will go high. So relax your head, relax your arms here around your legs, and stay in this position for a couple of minutes, maybe 5 minutes if you can, until your pain is relieved. This position is the prayer stretch, and you're going to find a mat and you're going to kneel down here with your feet stretched here, and you're going to start sliding down in front of you with your hands apart, and you're going to start going down, down, down. Tuck your chin inside and go in front, go, 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 and stay in this position. Try to relax your lumbar spine and try to relax your arms and shoulders, and do this for about 5 minutes. And stay in this position if you can, and then come back slowly when you finish. Be careful that you don't get dizzy when you get up. So this is the sitting flexion. So sitting on a chair with your knees apart, you're going to start flexing, bending forward, and you're going to try to bring your head to your lap, and if possible, touching your hands on the floor. And tuck your head in between your knees and stay in this position to relax your spine. And try to stay here until you're relaxed. Come back slowly, not to feel dizzy when you're coming back. So this is the pelvic tilt on the wall. It's important that you do this for your posture and to relax your lumbar spine. And you can find a wall, a door, anywhere you are, or even standing up in line, you can be doing this exercise. So what you'll be doing is you bend your knees a little bit, go down, and then you tuck your navels in, you touch all of the bones here, and then out. So then you'll be doing in and out, in and out. This is the cat-cow position. So the first thing you're going to do is look up and sag your spine down, look up, and here increasing the curvature of the spine, and alternate this with looking down and curving your lumbar spine up, up, up. So like your navel going up. And now the spine goes down and you look up. This is the cow. And alternate with the cat. And you can repeat this 8 times and increase to 12 and 20 repetitions. So the next exercise is the bird dog. So here again on your 4 points, on your hands and your knees, and you're going to raise one arm and one leg at a time, the opposite ones, right arm, left leg, and come back. If you're not used to do this, you can just start with the arm without the legs and just the legs without the arms. And when you're good with this, you can start alternating. So then the left arm and right leg straight, almost like if you want to reach the other walls in front of you, and the other one stretch, 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 hold here, keep your head down, contract your abdominals, your glutes, and then come back and repeat this 8 times for each side. And you can then increase to 12 and then 20 as you progress. So now this exercise is the push-up or curls up. You don't need to go all the way up. You can just, by the fact that you're raising your head and your trunk from the mat, that's enough. So what you're going to do is lying down on a mat with your knees bent. You're going to go up. And again, if you can't go all the way up, you can just go here and come back. This is really important because this is a strengthening of your abdominal muscles. And you can start, this is the easiest way when you have your arms stretched in front of you. This is the hardest. Here, for you to go up. And when you are starting to do this easier, then you can go this way here, which is even harder. So then you can just hold here and stay. Do this 8 repetitions. Come back, relax. 2, 3. But this, if this is too hard, you can put your arms in front of you and you will be easier for you. So this is easy, medium, harder. Do 8, 12, and then 20 repetitions. This exercise is the dead bug. So you're going to lie on a mat or on the floor, and you're going to raise your arms and your legs like this. And the goal of the dead bug is for you to flatten your lumbar spine here, the small of your spine, okay? And you're going to straighten one leg at a time. Don't touch the floor and come back. And then the other one. And when you're doing this, always try to remember to keep all of the bones of your small here touching the floor. And then you can start alternating with your arms. So left arm, right leg, and right arm, left leg. Don't touch the floor, just come back and do this 8 repetitions, and then you can increase to 12 and then increase to 20. I usually do 1 minute. I time 1 minute of dead bugs. I really like this exercise. It does a lot for my back pain. And in 1 minute, I can do 40, 45 dead bugs. And this is the bridge exercise. You're going to lie down on your mat or on the floor with your hands on the side of your body, your knees bent, your feet flat on the ground, and you're going to raise your pelvis. And the important thing is that you are like a straight line here, and you'll be engaging your abdominal muscles and your gluteus muscles. And you can stay here, count to 10 seconds, and then you can increase to 20, 30 seconds. And you repeat this a couple of times. And I like to do repetitions, 8 repetitions, and each repetition I hold here, and I hold, and I engage my abdominals and gluteus muscles, contract them, try not to shake, and then come back. This is the pelvic tilt exercise. You're going to lie down with a pillow under your head, your knees bent, your feet apart from each other. And what you're going to do is you're going to lie flat, you're going to move your pelvis up and down. So you lie flat, your pelvis will do this movement, and all the bones here will touch the floor or the mat, and then you move your pelvis this way and then this way. So backwards and forwards. This is pelvic tilt to increase the mobility of your lumbar spine. And do this 8 repetitions, 5, 6, 7, 8, and then you may repeat this many times, and you can then increase to 12 or 20 repetitions. You may leave your arms when you're doing this exercise here or on the side of your body. So this is the hip clamp exercise. Put a pillow under your head and lie down on the mat. Your knees bent and your feet together. And what you're going to do is you're going to open your knees like a clam opening. And you have to do this for both sides. So you do 8 repetitions for the left side, and then turn on the other side and do 8 for the right side. Keep your feet together in line. Your ankles should be aligned with your spine, and you will be doing this. This will be strengthening of the gluteus medius muscles, the piriformis muscles, which are very important to keep the stability of your hips and lumbar spine when you are walking. So this next exercise is the side lying leg lifts. Put a pillow under your head for comfort. And the lower leg, you're going to bend the knee. The upper leg here, you're going to keep straight. And you're going to raise, keep the knees straight and the toes pointing down. And you're going to do this. Then start with 8 repetitions, and then you can increase to 12 and 20 repetitions. This is really important to strengthen the muscles that do the abduction of our hip. Try to keep your body straight, and do this for the left side, and then you're going to turn and do the same thing for the right side. And once you have done 8 repetitions, if this becomes easy for you, you can start increasing to 12 and 20 repetitions.